Bismillahirrahmanirrahim. Hadith of the day. Prophet Muhammad sallallahu alaihi wasallam said, "Whoever helps his brother in his time of need, Allah will be there in his time of need." Assalamu alaikum, everyone. I am Dr. Marina Akhtar, PGR Community Medicine. My topic of discussion is measures of dispersion. I'm presenting this topic under the kind supervision of Prof.Dr. Saira Afzal. Learning outlines. Definition of dispersion, objective of dispersion, range, interquartile range, and deviation, standard deviation, variance, coefficient of variation. Learning outcomes. At the end of presentation, participant will be able to describe the basic measures of dispersion, their interpretations, and applications. Dispersion. Dispersion refers to the variations of the items among themselves around an average. Greater the variation among different items of series, more will be dispersion. As per Wale, dispersion is the measure of variation of the items. Here shown two curves. This curve of year 2015, there is more dispersion as values lies away from the mean value. So this curve is more better because there is less dispersion and the values lies close to the mean value. Objective of measure of dispersion: to determine the reliability of an average, to compare the variability of two or more series, for facilitating the use of other statistical measures, basis for statistical quality control. Properties of a good measure of dispersion: easy to understand, simple to calculate, uniquely defined based on all observation, and it is not affected by the extreme observations, capable of further algebraic treatment. Here is the classification of measures of dispersion. It is divided into two main classes: absolute measures and relative measures. And absolute measures are further classified into the range, quartile deviation, mean, absolute deviation, standard deviation. And relative measures are further classified into the coefficient of variation, coefficient of quartile deviation, and the coefficient of mean deviation. Methods of measuring dispersion. Range, these are classes: interquartile range and quartile deviation, mean deviation, standard deviation, coefficient of variation. First of all, we study about range. It is the simplest measure of dispersion. It is defined as the difference between largest and the smallest value. R equals L minus S. Range equals largest value minus smallest value. Coefficient of the range. Here is the formula to measure the coefficient of the range: large minus small value divided by large plus small value. Calculating range and the coefficient of range. Find the range and the coefficient range of the following data. Here is data given. We will arrange the data in ascending orders, and we will find range. Range equals largest value minus smallest value. Largest value is 35 and smallest value is 15 here, and range is 20. And coefficient of range, we will put data in this formula. Then we will get the answer 0.4. Merits and demerits of range. Merits: simple to understand, easy to calculate. Range is widely used in statistical quality control. Demerits of the range: it can't be calculated in open-ended distributions, not based on all the observation, affected by sampling fluctuation and affected by extreme values. Interquartile range and quartile deviation. Interquartile range is the difference between the upper quartile and the lower quartile. It covers the dispersion of the middle 50% of the items of the series. Symbolically, interquartile range equals Q3 minus Q1. Quartile deviation is half of the interquartile range. It is also called semi-interquartile range. Symbolically, quartile deviation equals Q3 minus Q1 over 2. Coefficient of quartile deviation, it is relative measure of quartile deviation. Coefficient of quartile deviation equals Q3 minus Q1 divided by Q3 plus Q1. Now we will practice about quartile range. For finding the quartile range, first we will order the values in ascending orders, and we will find the median, which is 24. Median is the middle value, and then we will find quartile Q1. Q1 is the median of the values left to the main median of the value, and Q3 is the median of values on the right side of median. So interquartile range is Q3 minus Q1, 28 minus 18 equals 10, and quartile deviation here is the divided by 2, and 10 divided by 2 equals 5. Coefficient of quartile deviation, we will put the value in this formula. Then our answer will be 0.217. Mean deviation. The average of absolute values of deviation from the mean, median, or mode is called mean deviation. This is the formula of mean deviation. Mean deviation is equal to summation of the x minus x bar. Here x bar is the mean and it is individual value divided by n. N is the number of observations. For example, the diastolic blood pressure of 10 individuals was as follows, and we will find the mean deviation. As shown in this table, these x in this column represent the individual values, and this column represent the arithmetic mean, and this column represent the x minus x bar deviation from the mean, and this is the total deviation from the mean, and this is the total addition of the values. Summation of x, which is 810, and arithmetic mean is the summation of x over n, which is 81. And now the difference as shown here, and summation of difference is given 56, and by putting the values in this formula we will get mean deviation 5.6. Merits and demerits of mean deviation. Merits: simple, it is simple, based on all values, less effects of extreme values. And demerits are inaccuracy, not capable of algebraic treatment, and unreliable. Now next topic is standard deviation. Most important and widely used measure of dispersion, first used by Carl Pearson in 1893, also called root mean square deviation. It is defined as the square root of the arithmetic mean of the square of the deviation of the values taken from the mean. It is denoted by sigma, and this is the formula: summation of xi minus mu. Mu represent the mean square and divided by n, and square root over all this value. This table shows these three formulas. This formula is the population standard deviation. It represents sigma equals summation of xi minus mu, then square of this divided by n. Sample variation is the square of population standard deviation, so square root is cancelled here. And the sample standard deviation, and this is shown here, is the difference in both these formulas is we will not only use n but n minus 1 in both these formulas, in sample variation and sample standard deviation. For example, the diastolic blood pressure of 10 individuals as shown, we will first of all we will find the arithmetic mean, that is the summation of x given as a 81, as shown is this table. X is the individual values, it is the variations, x minus x bar, variation from the mean, and this is given square of these values, and we will put these values in the formula, and our answer will be 7.31. Why is the standard deviation important? Things like heights of the people in a particular population tend to roughly follow a normal distribution. Standard deviation are important here because the shape of the normal curve is determined by its mean and standard deviation. The mean tells you where the middle and the highest part of the curve should go. This curve showing that a mean value will be there, and this curve showing that most of the values will lie close to the mean value and there is less dispersion. Why standard deviation is important in research? Standard deviation tells us about the shape of our distribution and how close the individual data values are from the mean value. Standard error tells us how close our sample mean is to the true mean of the overall population. Together, they help to provide the more complete picture than the mean alone can tell us. Interpretation. Low standard deviation mean data are clustered around the mean, and the high standard deviation indicate the data are more spread out. A standard deviation close to zero indicate the data points are close to the mean. A high or low standard deviation indicate data points are respectively above or below the mean. How is the standard deviation used in the real life? You can also use standard deviation to compare two sets of data. For example, a weather reporter analyzes the high temperature forecasted for two cities. A low standard deviation would show a reliable weather forecast. Merits and demerits of standard deviation. Merits. It is based on every item of the distribution. It is possible to calculate the combined standard deviation for comparing the variability of two or more distribution. Coefficient of variation is considered to be most appropriate. It is used most prominently used in further statistical work. Demerits are compared to other, it is difficult to compute and it gives more weight to the extreme values, less to those which near to the mean. And this is the example. Find the mean respiration rate per minute and its standard deviation when in 4 cases the rate was found to be 16, 13, 17 and 22. Now, as we will put the values in this formula and our answer will be 3.2. Next is variance. Variance is another measure of dispersion. It is the square of standard deviation. It is shown by square of sigma. The variance is the measure of variability. It is calculated by taking the average of square deviation from the mean. Variance tells you the degree of spread in your data. The more spread the data, the larger the variance in relation to the mean. Variance is the average square deviation from the mean, while standard deviation is the square root of the number. Both measures reflect validity in distribution, but their units differ. Standard deviation is expressed in the same units as original values, minutes or meters. But as for the variance, this is units of variance are squared and units are meaningless. When calculating the population standard deviation, the sum of the square deviation is divided by n, then the square root of the result is taken. Coefficient of variation. It was developed by the Carl Person. It is important relative measure of dispersion. It is used in comparing the variability, homogeneity, stability, uniformity, consistency of the two or more series. Higher the coefficient of variation, the lesser the consistency. The ratio of the standard deviation to the mean and shows the extent of variability in relation to the mean of the population. The higher the coefficient of variation, the greater the dispersion. Here showing the formula of coefficient variation for population. Coefficient formula of the coefficient variation will be standard deviation divided by mean value. Here sigma is the standard deviation and mu is the mean value multiplied by 100. This is for population and this formula is for the sample. And standard deviation, this is the formula for standard deviation of population and this formula representing the standard deviation of sample. Here and here and minus 1. Number of observation minus 1 will be given. Advantages and disadvantages. The coefficient of variation is useful because the standard deviation of the data must always understood in context of the mean of the data. The coefficient of variation is unitless, dimensionless number. So when comparing between data sets with different units or widely different means, one should use the coefficient of variation for comparison instead of standard deviation. Disadvantages. When the mean value is near zero, the coefficient of variation is sensitive to small changes in the mean, limiting the usefulness. And now coming to the recent updates. Here we have an article published in Journal of Thrombosis and Hemostasis. The procoagulant pattern of the patient with COVID-19 acute respiratory distress syndrome. We will see in this article the importance of interquartile range. Objective of this article was prospective observation study aimed to characterize the coagulation profile of COVID-19 acute respiratory distress syndrome patient with standard and the vasoelastic coagulation test and to evaluate their changes after establishment of an aggressive thromboprophylaxis. And as shown in result, at the baseline, the patient showed procoagulant profile characterized by increased clot strength, CS clot strength, median 5 hectopascal, 95% of interquartile range, 35 to 63, platelet contribution to clot strength is PCS 43 or hectopascal, and interquartile range 24 to 45, fibrinogen contribution to CS, FCS, fibrinogen contribution to clot strength, 12 HPA interquartile range 6 to 13.5, elevated D dimers values is 5.5 microgram per milliliter, interquartile range is 2.5 to 6.5, and hyperfibrinogenemia 794 milligram per deciliter, interquartile range is 583 to 933. Fibrinogen levels were associated with R square equals 0.503 and P probability value equals 0. Yes, 0.003 with interleukin 6 values. After increasing the thromboprophylaxis, there was coefficient P equals 0.001, time-related decrease of fibrinogen level, D dimers P equals 0.017, and clot strength P equals 0.013, and PCS platelet contribution to clot strength, which here probability is 0.035, and FCS fibrinogen contribution to clot strength P equals 0.38. Here is in the result, and we will conclude in this article, the procoagulant pattern of this patient may justify the clinical report of thromboembolic complications, pulmonary embolism during the course of the disease. Further studies are needed to assess the best prophylaxis and the treatment of this condition. Now coming to the MCQ session. MCQs number 1. A sample of 10 students have been taken to find out how much time in minutes is required to complete 20 MCQs based on question paper. The time each student consumed is given below. In their mean is 19. Calculate standard deviation. Values are given in this table, and we will put this data in this formula, and our answer will be 1.83. So in this MCQs, option D is correct answer. MCQs number 2. Which one of these statistics is unaffected by the outliers? Option A, mean. Option B, interquartile range. Option C, standard deviation. Option D, range. Option E, mean deviation.
B.
Yes, answer is B. MCQs number 3. How does the sample standard deviation better estimate the population standard deviation? By calculating option A, by calculating the square root of the sample variation. Option B, by dividing by n minus 3 instead of just n. Option C is by squaring the sample standard deviation. Option D is by calculating the difference between each individual score and the mean of the sample. Option E is by taking only small values.
A.
C.
No, answer is B, by dividing n minus 1 instead of just n. MCQs number 4. The average cost of the 100 pain medication painkiller was rest 200 rupees with a standard deviation of 40. Now, if the price of each pain medication is increased to 20%, how will it affect the mean cost? Option A, the mean cost will remain unchanged. Option B, mean cost will be increased by 20%. Option C is mean cost will increase by 40%. Option D is mean cost will be increased by 220. And option E is mean cost will be rest 300.
B.
Yes, B is the right answer. The mean cost will be increased by 20%. MCQs number 5 is standard deviation of set of 90 observation is 105. If the value of each observation is decreased by 9, then new standard deviation of these observation would be: option A, remain same. Option B, decrease to 96. Option C is decrease to 100. Option D is increase to 114. Option E is increase to 110. Decrease by 9. So the answer will be decrease to 96. MCQs number 6 is measures of dispersion which uses only two values are: option A, range. Option 2, standard deviation. Option C, mean deviation. Option D, variance. And option E is the coefficient of variation.
A.
C.
Range.
Yes, A. Two values. This is answer is range. MCQs number 7 is there are 50 individuals in the population and they have same hemoglobin level. That is 14 gram per deciliter. As there is no variability, the standard deviation will be: option A, 0. Option B, 1 and minus 1. Option C, 0 and 1. Option D, plus 2. Option E, minus 2.
B.
A. As the same hemoglobin level, same है level, and there is no variability and standard deviation, we have to find the standard deviation, which is 0. MCQ 8. If in one of the group of the premature infants, the maximum value for hexosaminidase A was substituted with a much higher value, which of the given value remain unchanged? Option A, variance. Option B, range. Option C, standard deviation. Option D, median. And option E, mean. Which value will remain unchanged?
B.
D.
Option D. Yes, option D is right answer. MCQs 9. A newly anti-hypoglycemic drug has been given to 7 poorly controlled fasting blood sugar individual at night. Their fasting blood glucose level are then tested in the morning before breakfast, which are listed in the table. Find the interquartile range and quartile deviation. No, solution is interquartile range. We will order the values in ascending order, then find the median of values, and then Q1, which is the median on the values left side of the median, and Q3 is the median of values which are on the right side of median. Then interquartile range is Q3 minus Q1. The answer is 100 and quartile deviation is 50. Option C is right answer. Now, last MCQs is a person having dengue has treated his platelet count from 4 different laboratories. The values are given in the table. Find the range and coefficient of the range for the following data. Range and coefficient of range. As we know, range is the difference between largest value minus smallest value. Largest value here is 40 and smallest value is 30. Then 40 minus 30. Answer is
E.
option E. Yes.
E.
Yes. This is key of my MCQ. This is reference of my presentation, and this is a link of our YouTube channel. Kindly like and subscribe. And then
Okay,
thank you
thank
so
you.
much.
Okay, thank you very much, Dr. Marina. Very nice presentation. If you please stop the recording because I have to comment on your slides. Would you please stop the recording?